So in 1997, the American Academy of Pain Medicine says, look, we've got all these people suffering with pain. It should be allowable to prescribe chronic opioid medication for these people in order to help with their pain problem. It was a compassionate act. It was an attempt to give some solution to for these people who were suffering, because nothing else we were doing is working for them. All right? One thing you need to remember about opioid medication is that they are a medication that should be of last resort. All right? This is an admission of failure. This says we have nothing else we can do to make your pain better. Let's see if we can at least cover it up and get you at a higher level of functioning. But we can't fix the underlying problem. We've given up on that once we're at these medications. They can be a godsend, but they should be very limited in their use. We created a problem. Between 1997 and 2007, where our last statistics are, the leading opioid medications, oxycodone, increased in sales by 866%. Fentanyl, 525%. Hydrocodone, 280%. Morphine, 222%. Just on the basis of our saying it was okay to use opioid medications for chronic, benign pain, non-cancerous pain. Gram for gram, people in the United States now consume more narcotic medication than anybody else in the world. I don't think that was the goal we were shooting for. 90% of the patients taking opioid medications were prescribed these for chronic, benign pain syndromes. One simple little paper in 1997, and we created an epidemic. And there are really severe consequences of that epidemic. At the tip of this iceberg, we're looking at 17,000 drug overdoses related to prescription medication. Fully 60% of those deaths, so what happens is a percentage of the medications get diverted, somebody steals them, somebody sells them, whatever happens with them. But if you look at just the 60% of those deaths, 60% occurred in patients when they were given prescriptions based on the prescription guidelines by medical boards. The VA hospital had patients dying of overdoses in the hospital by medications that were properly prescribed. They are not taking overdoses. They're not attempting to hurt themselves. They took the medications as prescribed and died in the hospital. We created a real big problem. Without more effective, this was in JAMA just last year, without more effective and less costly approaches to pain management, the estimated cost of care and disability to the country will approach $5 trillion. Now the really bad news. They were only talking about the vets. They were not talking about all the rest of us. I can't even imagine what that number is going to be if you add in all the rest of us. So we have a problem. So a number of years ago, I sat down with a group of colleagues and we said, okay, what is it about these two diseases that they have in common? What is it? Can we somehow gain some understanding as to what it is we're treating? Because we're treating something and we actually don't know what it is. So we started looking at the literature, and what we found that there were a lot of common neurotransmitters. Now, neurotransmitters are where the nerves get really close together, but they don't actually touch. What happens is they send out a packet of chemicals that stimulate the next nerve to go on. And we found that certainly there was a large number of neurotransmitters that were disrupted both in chronic pain and in chronic depression. We found that there were multiple elevated inflammatory factors, elevated cytokines, specifically things like interleukin-1, interleukin-6, tissue necrosing factor alpha, and that there was degeneration of the brains in all of these people. This is a really serious illness. So we're looking at an inflammatory condition. We are looking at conditions which overlap neuroanatomically, neurophysiologically. We're looking at conditions that have commonalities in the fact that they are both neuroinflammatory diseases. And we're looking at two diseases which are neurodegenerative diseases. These are very serious problems. So let's stop and chat for a second as far as what inflammation is. Because inflammation is different things in different parts of the body. Right? So if we were going to be smart about this, we needed to understand what that was. If you have a runny nose and swollen eyes as a result of our lovely spring, these are allergies. The thing that's causing all these runny noses and itchy eyes is histamine release in the body as a result of antigen-allergen response from pollens. So what you want to do to solve that inflammatory problem is either take the immunotherapy to prevent the occurrence of the antigen response to begin with, or take an antihistamine, right? Because antihistamine is what's mediating the inflammation. Okay. If you've got a cut on your leg and it's all red and swollen, the antihistamine is not going to do any good there, is it? Because the problem there is an infection from bacteria. That requires an antibiotic. So if we're going to treat that inflammation, we need an antibiotic in order to kill off the cause of the inflammation. So what is it that causes inflammation in the brain? It turns out in the central nervous system, the mediator of inflammation is a small cell called the microglia. This is very important. So what we did was we turned around and we said, okay, if the cause of inflammation in the brain is microglia, let's go find out what microglia are. So microglia are the innate immune system in the central nervous system. They are the things that run around and start the reparative process. In children, neonates, they are absolutely essential for the nerve pathways to form straight and true. So that you've got lots of nerve growth going on, there can be crisscrossing and some neurotangles. These guys make sure that those tangles get untangled and that all the highways are functioning the way they're supposed to. So they're extremely important in children. In adults, it turns out that they have a lot of reparative process also, but they're not quite as active. They fall into what's called a sessile state, a resting state. But they also have phenomenal functional plasticity. All right, these are big fancy words, which means that they can change their shape and their function and the things that they secrete. So they're rather clever little guys. And it turns out that they respond very quickly to any kind of injury to the brain, any assault on the brain. And they have a graded response, meaning that the greater the assault, the greater the response from the microglia, because they will move, they're amoeboid. They're the only thing in the central nervous system that isn't attached to something else. They're capable of moving twixt and tween the neurons. And they help maintain the integrity of the circuitry in the brain. So these guys are real important. These guys secrete all of the inflammatory factors that we see coming off in injury of the brain. And so what is it that gets these guys going on? Before we get there, what I did was I renamed this business of the co-occurrence of a chronic neuroinflammatory disease and depression. All right? Ultimately, at their basis, they're neuroinflammation, both depression and chronic pain. In the periphery, when you've got a single neuron that comes in and is activated at the spinal cord level, it's accepted terminology in the profession to call it central sensitization. That is a hyperreactive segment of the nerve. Because we saw so much going on in the upper motor neuron areas, in the upper neuron areas of the brain, and we see this overlap of neuropsychiatric conditions along with chronic pain, I relabeled this as central sensitization syndrome. And I talk about it at length in my book and how I came across that. So what we thought once upon a time was that depression and chronic pain caused inflammation, dysregulation, and degeneration of the brain. We'd been observing this for ages, but we thought you're depressed, that's what causes the problem. You have pain, that's what causes the problem. It's wrong. What we know is that inflammation and dysregulation and degeneration of the brain actually cause pain and depression. All right, this is a fairly revolutionary flip in the way we think about these things, because we have been treating the symptoms. And as a result of treating the symptoms, we get really crummy results. If you have both these symptoms together, The results are so bad as to be almost not worth going to the doctor to try and get help. We're flailing around in the dark. We've been so busy treating the thing that we've missed treating the cause. And this is where we have to change our thinking.